Welcome back at 8:12. The U.S. Food and Drug Administration, or the FDA, is warning about a rare but severe reaction when people stop taking Xyzal and Zyrtec. Those are common allergy medications. Some people might experience a side effect called pruritus, or severe itching all over your body. Dr. Reena Mehta from Uptown Allergy and Asthma joins us to take a closer look at these reactions. Dr. Mehta, good morning. Thanks for being with us.
Thank you for having me.
So let's first talk about why people might take a daily Xyzal or Zyrtec.
So a lot of people have seasonal allergies. 1 in 3 adults, 1 in 4 children have environmental allergies. So you would take it for things like sneezing, runny nose, congestion, itchy skin. And so now we're finding that maybe when you stop those medications too quickly, you might get a rebound itch.
What is it that's having people stop? And I guess that would lead to like these masses of people having this reaction. Why are people suddenly stopping these two specific allergy medications?
Well, I guess the question becomes is if you don't want to take allergy medicine every day, maybe then you would try to get off of it. There have been some studies that have shown that maybe chronic use of antihistamines could be linked to dementia and things like that. So some people feel like, okay, if I can get off of this thing that I've been taking for 30 years, wouldn't that be great? And I can minimize my medications.
But when people are quitting this cold turkey, they're experiencing this incredibly itchy all over their body skin itching sensation.
So what I'll say is this is pretty rare, but this is a warning that the FDA has now put out on these medications, specifically Zyrtec and Xyzal. Zyrtec more than Xyzal, that if you've been taking it for a long period of time, let's say months to years, if you abruptly stop it, then you may get this rebound itch. It's almost like a withdrawal where your skin gets very, very itchy for a few days and then usually it goes away.
But if it's just unbearable, what can you do or what should you do? Or if you're trying to get off of these medications, how do you maybe safely go about doing that?
So you may just decide to restart the medications because that usually fixes it. If you're trying to get off of these medications and you've been taking them for a long time, then a slow wean off of it is usually what I recommend to my patients. So if you're taking Zyrtec every day, maybe then you do Zyrtec every other day. Do that for a week, then switch it to every third day, and like basically slowly wean yourself off. If you do it that way in a slow fashion, usually that prevents the rebound itch.
Should you or would you encourage people to have conversations with their doctors if there's someone who suffers from allergies year-round and they rely on these for daily comfort? Would you just suggest maybe don't quit any medication so abruptly, talk to your doctor first?
Absolutely, yes. This is a common thing that people will come to my office to discuss. And then there are certain antihistamines that may not cause the rebound itch. So maybe something like Allegra or Claritin is something that you could try instead if you feel like you truly need to be on something every day and you're worried about that rebound itch.
All right, well, Dr. Mehta, thanks so much for helping us understand this FDA warning
about this very rare side effect when people quit taking these two specific allergy meds. We appreciate your time this morning.
Thank you for having me.
All right, time is now 8:15.